If your chest feels worse after you stop exercising, you're not imagining it. A lot of people expect symptoms during effort, not in the minutes after. But that post-workout window is when your body is switching gears fast. Heart rate drops, blood flow redistributes, and your breathing pattern changes. If that transition is abrupt, you can feel tightness, pressure, fluttering, or a can't get a full breath sensation. And once you notice it, worry can amplify every signal. The key is separating what's common and explainable from what needs urgent attention. In this breakdown, you'll learn why cool down matters, how breathing can trigger chest sensations, and how panic can mimic heart or lung problems. You'll also get practical ways to test patterns safely and reduce spikes without guessing. The goal is clarity, so you can respond calmly and appropriately when symptoms show up after exercise. Moving to slide 2. First, let's name the most common chest symptoms people report after exercise. One is tightness, like a band across the chest. Another is sharp, localized pain that changes with posture or a deep breath. Some feel palpitations, like skipped beats or a sudden thump. Others feel lightheaded, shaky, or flushed. And a big one is air hunger, where you keep trying to top up your breath. These sensations can come from different systems: heart, lungs, muscles, nerves, and digestion. The tricky part is that your brain doesn't label them neatly. It just flags chest as important. That's why context matters. What type of exercise, how hard, how long, and what happens when you slow down. When symptoms spike after stopping, it often points to the transition, cool down, breathing, and nervous system, more than the workout itself. Moving to slide 3. Here's the core idea. Exercise ramps up your sympathetic nervous system, your go mode. Your heart pumps harder, blood vessels and working muscles open up, and your breathing speeds up. When you stop suddenly, your muscles stop acting like pumps that push blood back to the heart. Blood can pool more in the legs for a moment. That can lower the amount of blood returning to the heart and briefly drop blood pressure. The result can be dizziness, chest awareness, or a sense that your heartbeat is weird. At the same time, your body is trying to downshift breathing and heart rate. If that downshift is messy, too fast, too shallow, or paired with breath holding, you feel it. This is why a structured cool down isn't just for athletes. It's a way to make the transition smoother, so your chest doesn't become the alarm bell. Moving to slide 4. Cool down is basically active recovery that keeps circulation stable while your heart rate comes down. A gentle walk, easy cycling, or slow marching for 5 to 10 minutes helps your veins return blood to the heart more steadily. That can reduce lightheadedness and that sudden chest drop feeling. It also gives your breathing time to normalize without you gasping or holding your breath. Another benefit is temperature regulation. When you stop, you can feel flushed, then chilled, which can trigger shallow breathing and tension in the chest wall. Cool down gives your nervous system a clearer signal that the threat is over. If you tend to get symptoms after exercise, treat cool down as part of the workout, not an optional add-on. The goal isn't to keep your heart rate high. It's to bring it down gradually and predictably. Moving to slide 5. Now let's talk breathing, because it's a major driver of post-exercise chest symptoms. During hard effort, many people switch to fast upper chest breathing. That's not wrong, but it can leave you over-breathing for your needs once you stop. Over-breathing means you blow off too much carbon dioxide. And carbon dioxide isn't just waste. It helps regulate blood vessel tone and the urge to breathe. When it drops quickly, you can get tingling, tightness, lightheadedness, and a feeling of not getting enough air. That feeling is confusing because you're breathing a lot, yet you feel starved for breath. After you stop, the fix is usually not a bigger breath. It's a slower breath with a longer exhale. That helps your system rebalance and can reduce chest sensations within minutes. Moving to slide 6. A second breathing pattern is breath holding without realizing it. People often hold their breath during the last hard seconds, when checking a watch, or when bending over with hands on knees. Breath holding increases pressure in the chest and changes blood return to the heart. That can trigger a pounding heartbeat, head rush, or chest pressure right as you stop. Another common pattern is repeated big sighs. Sighing feels like it should help, but it can keep your breathing irregular and maintain that air hunger loop. A steadier approach is simple. Inhale through the nose if possible, then exhale longer than you inhale. Even a 3-second inhale and 5-second exhale can be enough. You're not trying to force relaxation. You're giving your body a rhythm that makes the transition smoother. Moving to slide 7. Chest symptoms after exercise can also come from the chest wall itself, muscles, ribs, and connective tissue. During exercise, you brace your core, swing your arms, and load your upper body more than you think. After you stop, those tissues cool down and stiffen. If you've been breathing hard, the small muscles between the ribs can fatigue, similar to a calf muscle after running. That can feel like soreness, tightness, or a sharp pain with a deep breath. Another clue is reproducibility. If you can press on a specific spot and it recreates the pain, that points more toward chest wall sources. Posture matters too. Slumping after exercise compresses the front of the chest and can make breathing feel restricted. A gentle cool down plus tall posture often reduces these sensations over time. Moving to slide 8. Another contributor is reflux, stomach acid moving upward, especially after running, cycling in a tucked position, or exercising soon after eating. Reflux can cause burning, pressure, or a lump in throat feeling that shows up when you stop and bend forward. It can also trigger coughing or throat clearing, which then changes breathing and increases chest discomfort. Hydration and gulping air matter here too. Drinking a lot quickly or chewing gum can increase swallowed air and bloating. That can push up on the diaphragm and create a tight, crowded feeling in the lower chest. The important point is that reflux-related sensations can feel intense and cardiac, even when they're not. Patterns help. Symptoms tied to meals, certain positions, or a sour taste suggest a digestive component. It's one more reason the recovery period can be misleading. Moving to slide 9. Let's connect this to panic, because panic often arrives in the cool-down window. You notice a weird heartbeat or a tight breath. Your brain asks, what if this is dangerous? That thought increases adrenaline. Adrenaline increases heart rate, muscle tension, and breathing rate. Now the sensations are stronger, which feels like proof something is wrong. That feedback loop can turn a normal recovery sensation into a full panic episode. Importantly, panic symptoms are real physical symptoms. They are not made up. They're the body's alarm system firing at the wrong time. One way to spot this loop is timing. Panic often peaks fast, within minutes, and includes a strong urge to escape or check your pulse repeatedly. Learning to label the pattern, this is an adrenaline spike, can reduce escalation and shorten the episode. Moving to slide 10. A practical tool here is a simple recovery routine you repeat every time. Consistency teaches your nervous system what safe recovery feels like. Start with 3 to 5 minutes of easy movement. Then shift to a breathing cadence. Inhale gently, exhale longer for 1 to 2 minutes. Keep your posture tall and your jaw unclenched. If you feel air hunger, resist the urge to take a huge breath. Instead, slow the next exhale and let the inhale come naturally. If palpitations show up, note what happens when you keep walking versus stopping completely. Many benign rhythm sensations settle with gentle movement and a calmer breathing pattern. You're collecting data, not fighting your body. Over a few sessions, you can often reduce both the intensity and the fear response, because the ending becomes predictable. Moving to slide 11. It's also worth knowing what can make post-exercise chest symptoms more likely. One is dehydration or low electrolytes, which can increase palpitations and cramping sensations. Another is stimulants, high caffeine, pre-workouts, nicotine, because they raise baseline adrenaline. Poor sleep can do the same. Temperature swings matter too. Exercising in heat, then stopping in a cool breeze can tighten chest muscles and shift breathing. And intensity spikes are a big one. If your workout includes sudden sprints or heavy sets to failure, your nervous system stays revved longer into recovery. None of this means you can't train hard. It means you may need a longer cool down and a smoother step down in intensity. The pattern to watch is hard stop after a peak. That's the classic setup for symptoms that surge once you're done. Moving to slide 12. Now, a crucial piece. When should you treat chest symptoms after exercise as urgent? If you have chest pressure that feels heavy or crushing, especially if it spreads to the arm, jaw, neck, or back, take that seriously. If you have severe shortness of breath that doesn't improve with rest, or you feel faint or actually pass out, that's urgent. New neurologic symptoms like weakness on one side, confusion, or trouble speaking are urgent too. Also pay attention to symptoms that are new for you, escalating over time, or happening at lower and lower effort. The goal here isn't to make you anxious. It's to give you clear thresholds so you're not stuck debating. When in doubt, getting evaluated is a reasonable choice. Common patterns exist, but individual risk factors and medical history matter a lot. Moving to slide 13. If your symptoms are recurring but not clearly urgent, the most helpful next step is structured observation. Write down the workout type, intensity, and the exact moment symptoms start. During effort, right after, or 10 minutes later. Note breathing patterns, posture, hydration, caffeine, and whether you ate recently. Track how long symptoms last and what reliably improves them, like walking, slower exhales, or changing position. This kind of log is valuable if you speak with a clinician because it turns a vague story into patterns. It also helps you test one change at a time. For example, keep the same workout but add a longer cooldown for 2 weeks, or keep the same cooldown but reduce the intensity spikes. You're not trying to self-diagnose. You're trying to understand your triggers and reduce unnecessary alarms. Moving to slide 14. Bring it all together like this. Post-exercise chest symptoms often spike because recovery is a rapid transition. Cool down keeps circulation and blood pressure steadier. Breathing patterns, overbreathing, breath holding, and sighing can create real chest sensations that feel scary. And panic can amplify normal signals into a full-body alarm. Your best move is a predictable step down, easy movement, longer exhales, tall posture, and a calm mindset of I'm observing, not reacting. If symptoms are intense, new, or match red flags, treat that as a reason to seek urgent evaluation. Otherwise, use patterns to guide smarter training and recovery. If you want more videos like this, subscribe. And for a quick check-in, comment with your experience. Do your symptoms feel more like breathing trouble or more like heart pounding? A or B? This information is not a substitute for medical advice.